Question 1. Stakeholder feedback indicates a recurring challenge in emergency nursing practice involves patients who, while experiencing a life-threatening cardiac event, clearly articulate a refusal of advanced cardiac life support (ACLS) interventions. In such a scenario, what is the most ethically and legally sound course of action for the registered nurse? Option A. Attempt to ascertain the patient's understanding of their condition and the implications of refusing ACLS. Assess their capacity to make such a decision, and if capacity is present and the refusal is informed, respect their wishes. If capacity is absent, follow established protocols for emergent care and surrogate decision-making. Option B. Halt all ACLS interventions and wait for a family member or legal guardian to arrive and provide consent for treatment, regardless of the patient's immediate clinical status. Option C. Immediately initiate ACLS protocols as per standard guidelines, assuming the patient's refusal is a result of their acute medical condition and lack of capacity. Option D. Proceed with ACLS interventions only after documenting the patient's refusal, but without further assessment of their capacity or exploration of their reasoning. The correct answer is C. Immediately initiate ACLS protocols as per standard guidelines, assuming the patient's refusal is a result of their acute medical condition and lack of capacity. Explanation. This scenario presents a significant ethical and professional challenge for emergency nurses. The core conflict lies between respecting patient autonomy and the perceived best interest of the patient, particularly when the patient's decision-making capacity is in question during a critical event. The emergency setting amplifies this challenge due to the rapid pace, limited information, and the immediate need for life-saving interventions. The nurse must navigate the delicate balance of providing advanced cardiac life support (ACLS) while upholding the patient's right to refuse treatment, even if that refusal seems detrimental. The correct approach prioritizes obtaining informed consent or assessing capacity when possible, aligning with the ethical principles of autonomy and beneficence, and regulatory guidelines that mandate patient rights. In a situation where a patient is actively refusing ACLS, the nurse's primary responsibility is to attempt to understand the basis of the refusal and assess the patient's capacity to make such a decision. If the patient has capacity and is refusing, their wishes must be respected, even if it leads to a poor outcome. If capacity is questionable, the nurse must follow established protocols for assessing capacity, and if absent, proceed with interventions that are in the patient's presumed best interest, often involving surrogate decision-makers or emergency directives. This approach upholds legal and ethical standards of care, emphasizing patient-centered decision-making. An incorrect approach would be to unilaterally override a patient's refusal of ACLS based solely on the nurse's judgment of what is medically necessary, without a thorough assessment of capacity or exploration of the patient's reasoning. This violates the principle of patient autonomy and can lead to legal repercussions and ethical breaches. Another incorrect approach would be to delay necessary ACLS interventions indefinitely while attempting to locate a surrogate decision-maker, especially if the patient's condition is rapidly deteriorating and there is no clear indication of their wishes or capacity. This could be seen as a failure to provide timely and appropriate care, potentially violating the principle of beneficence. Proceeding with ACLS without any attempt to assess capacity or obtain consent when the patient is capable of expressing a refusal is a direct contravention of patient rights and established ethical frameworks. The professional decision-making process in such situations involves a rapid assessment of the patient's condition, a concurrent evaluation of their capacity to make decisions, and an understanding of their expressed wishes. If the patient has capacity and refuses, their autonomy is paramount. If capacity is impaired, the nurse must act in the patient's presumed best interest, which may involve initiating ACLS while simultaneously seeking to identify and involve surrogate decision-makers or consulting with the healthcare team and ethics committees if available. Adherence to institutional policies and professional nursing standards of practice is crucial. Question 2. The analysis reveals a patient presenting to the emergency department with a life-threatening condition. The patient has a valid advance directive clearly stating a refusal of all blood transfusions. The patient is currently unable to communicate their wishes due to their critical state. The patient's spouse, present at the bedside, is distraught and insists that the patient would want the transfusion, contradicting the advance directive. The emergency nurse is faced with the immediate need to administer a blood transfusion to stabilize the patient. Option A. Proceed with the blood transfusion, prioritizing the spouse's immediate wishes over the advance directive due to the patient's inability to communicate and the spouse's emotional state. Option B. Delay the blood transfusion until a court order can be obtained to clarify the patient's wishes, even if this risks the patient's immediate deterioration. Option C. Administer the blood transfusion based on the spouse's insistence, assuming the advance directive may no longer reflect the patient's current desires. Option D. Administer the blood transfusion as per the advance directive, while continuing to attempt to de-escalate the spouse's distress and involve the healthcare team for support. The correct answer is D. Administer the blood transfusion as per the advance directive, while continuing to attempt to de-escalate the spouse's distress and involve the healthcare team for support. Explanation. The analysis reveals a scenario that is professionally challenging due to the inherent conflict between patient autonomy and the perceived best interests of the patient, further complicated by the presence of a surrogate decision-maker whose wishes may not align with the patient's documented preferences. Emergency nurses must navigate these complex ethical and legal waters with precision, balancing the immediate need for care with established rights and responsibilities. Careful judgment is required to uphold patient dignity and legal obligations. The correct approach represents best professional practice because it prioritizes the patient's documented wishes, as expressed through an advance directive, over the surrogate's current objections. This aligns with the ethical principle of patient autonomy, which is legally protected in the United States. Emergency nurses are bound by the Emergency Medical Treatment and Labor Act, EMTALA, to provide a medical screening examination and stabilizing treatment. But this does not supersede a competent patient's right to refuse treatment, even if that refusal is documented in an advance directive. Adhering to the advance directive respects the patient's right to self-determination and avoids potential legal ramifications for overriding their clearly stated wishes. An incorrect approach that involves proceeding with the intervention against the patient's documented wishes, despite the surrogate's objection, represents a significant regulatory and ethical failure. This would violate the principle of patient autonomy and could lead to legal action for battery or violation of patient rights. Another incorrect approach, which is to delay necessary treatment solely based on the surrogate's immediate emotional distress and conflicting statements, without attempting to clarify the patient's wishes or the validity of the advance directive, fails to meet the standard of care and potentially violates EMTALA requirement for timely stabilizing treatment. Furthermore, ignoring the advance directive entirely and solely deferring to the surrogate's current wishes, even if the surrogate claims the patient would change their mind, is a failure to uphold the patient's established legal and ethical rights. Professionals should employ a decision-making framework that begins with identifying the ethical principles at play: autonomy, beneficence, non-maleficence, justice. Next, they should gather all relevant information, including the patient's condition, available medical history, and any advance directives. Legal obligations, such as EMTALA, must be considered. When conflicts arise, such as between a surrogate and an advance directive, the nurse should seek clarification, consult with the healthcare team, and involve ethics committees or legal counsel if necessary. The ultimate goal is to act in accordance with the patient's known wishes and legal mandates, ensuring patient safety and respecting their rights. Question 3. Cost-benefit analysis shows that implementing a new rapid diagnostic tool for a specific cardiac biomarker in the emergency department could reduce door-to-balloon times for STEMI patients by an average of 15 minutes. However, the initial capital investment and ongoing reagent costs are significant. An emergency nurse observes a physician ordering a less sensitive but readily available troponin assay for a patient presenting with classic signs of acute myocardial infarction, despite the availability of the newer, more accurate, and faster diagnostic tool. The nurse believes the physician's choice may lead to a delayed diagnosis and treatment for this high-risk patient. What is the most appropriate role and responsibility of the emergency nurse in this situation? Option A. Directly and respectfully engage the physician to clarify the rationale for the chosen troponin assay and advocate for the use of the more rapid diagnostic tool, citing patient acuity and potential benefits. Option B. Accept the physician's order as written, document the observation of the patient's symptoms, and proceed with the less sensitive troponin assay. Option C. Immediately report the physician's order to the hospital administrator, citing concerns about resource utilization and potential patient harm. Option D. Document the physician's order and the nurse's concerns in the patient's chart and wait for a supervisor to review the situation. The correct answer is A. Directly and respectfully engage the physician to clarify the rationale for the chosen troponin assay and advocate for the use of the more rapid diagnostic tool, citing patient acuity and potential benefits. Explanation. This scenario is professionally challenging because it requires the emergency nurse to balance immediate patient needs with the broader responsibilities of resource management and interdisciplinary collaboration, all within the scope of emergency nursing practice, as defined by the Board of Certification for Emergency Nursing, BCEN. The nurse must prioritize direct patient care while also recognizing the impact of their actions on the overall efficiency and safety of the emergency department. Careful judgment is required to ensure that patient advocacy does not compromise the established protocols for patient flow and resource allocation. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of the emergency nurse's multifaceted role. By initiating a direct conversation with the physician to clarify the patient's needs and the rationale for the current treatment plan, the nurse is acting as a patient advocate and a critical member of the healthcare team. This aligns with BCEN emphasis on the nurse's responsibility to assess, plan, implement, and evaluate patient care, which includes questioning and clarifying orders when necessary to ensure patient safety and optimal outcomes. This proactive communication fosters a collaborative environment and ensures that the patient receives appropriate and timely care, reflecting the ethical principles of beneficence and non-maleficence. An incorrect approach that involves immediately escalating the situation to a supervisor without first attempting direct communication with the physician fails to leverage the nurse's direct knowledge of the patient and the situation. This could be seen as a failure to exercise independent professional judgment and could delay necessary interventions. It also bypasses a crucial step in collaborative problem solving, potentially creating unnecessary friction within the team. Ethically, this approach might be viewed as a lack of assertiveness in patient advocacy. Another incorrect approach, such as accepting the physician's order without further inquiry due to perceived time constraints or hierarchy, represents a failure in the nurse's duty to advocate for the patient and to ensure the appropriateness of medical orders. This could lead to suboptimal care or even patient harm, violating the ethical principle of non-maleficence. It also neglects the BCEN expectation that nurses actively participate in the decision-making process and question orders that appear questionable. Finally, an incorrect approach that involves documenting concerns without addressing them directly with the physician or team risks perpetuating a potentially problematic care plan. While documentation is essential, it should follow direct attempts to resolve the issue. Relying solely on documentation without active intervention can be interpreted as a passive approach to patient care and a missed opportunity to improve the immediate situation, potentially failing to uphold the nurse's responsibility to ensure the patient's well-being. The professional decision-making process for similar situations should involve a systematic approach. First, assess the patient's condition and the current treatment plan. Second, identify any discrepancies or concerns based on professional knowledge and standards of care. Third, initiate direct, respectful communication with the physician to clarify the order and express concerns. If the concerns are not adequately addressed, then consider escalating the issue through appropriate channels, such as a charge nurse or supervisor, while continuing to advocate for the patient. Documentation should occur at each stage to reflect the actions taken and the rationale behind them. Question 4. Research into best practices for emergency nursing reveals a scenario where a competent adult patient in the emergency department refuses a life-sustaining intervention, citing personal beliefs. The patient's family strongly advocates for the intervention, expressing concern for the patient's well-being and urging the nursing staff to proceed. What is the most appropriate course of action for the emergency nurse in this situation? Option A. Immediately proceed with the life-sustaining intervention as requested by the family, prioritizing their expressed concerns over the patient's stated refusal. Option B. Delay the life-sustaining intervention indefinitely until all family members are in complete agreement with the patient's decision, regardless of the patient's capacity. Option C. Defer to the family's wishes and cease all efforts to administer the refused intervention, even if it means the patient's condition deteriorates due to lack of treatment. Option D. Initiate a formal capacity assessment to determine the patient's ability to understand their medical situation and the implications of their decision, while continuing to provide supportive care and facilitate communication between the patient, family, and medical team. The correct answer is D. Initiate a formal capacity assessment to determine the patient's ability to understand their medical situation and the implications of their decision, while continuing to provide supportive care and facilitate communication between the patient, family, and medical team. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in emergency nursing, balancing a patient's expressed wishes with perceived best medical interest, especially when the patient's capacity is in question. The emergency setting amplifies the urgency and potential for rapid deterioration, making timely and ethically sound decision-making paramount. The nurse must navigate potential conflicts between the patient's autonomy, the family's concerns, and the healthcare team's medical judgment, all while adhering to professional standards and legal requirements. Correct approach analysis. The correct approach prioritizes a systematic assessment of the patient's capacity to make informed decisions. This aligns with the ethical principle of patient autonomy, which is a cornerstone of healthcare practice. By engaging in a structured capacity assessment, the nurse upholds the patient's right to self-determination as long as they possess the cognitive ability to understand their situation, the risks and benefits of treatment options, and the consequences of their choices. This process involves clear communication, observation of the patient responses, and potentially consultation with the interdisciplinary team. If capacity is confirmed, the patient's wishes, even if they differ from the family's or team's preferences, must be respected within legal and ethical boundaries. This approach is supported by nursing codes of ethics and legal precedents that emphasize patient rights and informed consent. Incorrect approaches analysis. One incorrect approach involves immediately deferring to the family's wishes without a thorough assessment of the patient's capacity. This violates the principle of patient autonomy and can lead to the imposition of unwanted medical interventions, constituting a breach of ethical and potentially legal obligations. It undermines the patient's right to self-determination and can erode trust in the healthcare system. Another incorrect approach is to proceed with a treatment the patient has refused, based solely on the perceived benefit or the family's insistence, without a formal capacity assessment. This directly contravenes the patient's right to refuse treatment, even if that refusal seems medically inadvisable. It is a failure to uphold patient rights and can result in battery or other legal ramifications. A third incorrect approach is to delay necessary medical interventions due to the family's objections, without first attempting to clarify the patient's wishes or assess their capacity. While family involvement is important, the primary focus must remain on the patient's well-being and their right to receive care. Prolonged delay can lead to adverse patient outcomes and may be considered a failure to provide timely and appropriate care. Professional reasoning. Professionals should employ a decision-making framework that begins with a rapid but thorough assessment of the patient's immediate condition and then moves to evaluating their capacity to make decisions. This involves direct communication with the patient, observing their understanding and reasoning, and assessing their ability to communicate a choice. If capacity is questionable, a formal assessment process should be initiated, involving the interdisciplinary team. Throughout this process, open and empathetic communication with both the patient and their family is crucial, aiming to build consensus and ensure the patient's best interests are met while respecting their autonomy. Question 5. Examination of the data shows a consistent increase in patient wait times for initial nursing assessment in the emergency department, impacting patient satisfaction scores and potentially delaying critical interventions. Which of the following approaches best addresses this process optimization challenge within the framework of emergency nursing fundamentals? Option A. Implement a standardized triage protocol that categorizes patients based on acuity and directs them to appropriate care pathways immediately upon arrival, supported by ongoing data collection to monitor effectiveness and identify further areas for refinement. Option B. Allocate additional nursing staff to the department during peak hours without a concurrent analysis of existing workflow inefficiencies or the implementation of standardized assessment tools. Option C. Focus on individual nurse efficiency by encouraging faster patient turnover, assuming that increased individual speed will naturally resolve system-wide delays. Option D. Rely on experienced nurses' intuition to identify patients who may be experiencing more severe conditions, bypassing formal assessment for those who appear less urgent. The correct answer is A. Implement a standardized triage protocol that categorizes patients based on acuity and directs them to appropriate care pathways immediately upon arrival, supported by ongoing data collection to monitor effectiveness and identify further areas for refinement. Explanation: this scenario is professionally challenging due to the inherent variability in patient presentations within the emergency department and the critical need for timely, accurate assessment and intervention. The pressure to optimize patient flow while maintaining high-quality care requires a systematic and evidence-based approach. Careful judgment is required to balance throughput with individual patient needs, ensuring no patient is overlooked or receives suboptimal care due to system pressures. The correct approach represents best professional practice because it prioritizes a structured, evidence-based method for evaluating and improving emergency nursing processes. This aligns with the core principles of emergency nursing, which emphasize rapid assessment, critical thinking, and efficient resource utilization. Adherence to established protocols and continuous quality improvement initiatives, as mandated by professional nursing standards and regulatory bodies governing emergency care, ensures patient safety and optimal outcomes. This approach fosters a culture of accountability and learning, essential for maintaining high standards of care. An incorrect approach that relies solely on anecdotal evidence or personal experience without systematic data collection and analysis fails to meet professional standards. Such an approach risks perpetuating inefficiencies or unsafe practices, as it lacks objective validation. It may also violate ethical principles of beneficence and non-maleficence by potentially leading to delayed or inappropriate care. Another incorrect approach that focuses on individual patient throughput without considering the overall system's impact on care quality is problematic. This can lead to gaming the system, where individual metrics are met at the expense of holistic patient management or team collaboration, potentially compromising patient safety and violating principles of patient advocacy and professional responsibility. A third incorrect approach that disregards established emergency nursing protocols or guidelines in favor of expediency undermines the foundation of safe and effective care. This can lead to inconsistent care delivery, increased risk of errors, and a failure to adhere to regulatory requirements designed to protect patients. It demonstrates a lack of professional accountability and a disregard for the evidence base that informs best practices. Professionals should employ a decision-making framework that begins with data-driven assessment of current processes. This involves identifying bottlenecks, evaluating patient outcomes, and soliciting feedback from the nursing team. Next, evidence-based interventions or process modifications should be identified and implemented, followed by rigorous evaluation of their impact. This cyclical process of assessment, intervention, and evaluation, grounded in professional standards and ethical considerations, ensures continuous improvement in emergency nursing care delivery. Question 6. Risk assessment procedures indicate a 65-year-old male presenting to the emergency department with sudden onset of severe substernal chest pressure radiating to his left arm, accompanied by diaphoresis and shortness of breath. He denies any recent trauma or known allergies. Which of the following initial nursing actions best reflects a risk-stratified approach to this cardiovascular emergency? Option A. Immediately performing a 12-lead electrocardiogram (ECG) and notifying the physician of potential acute coronary syndrome. Option B. Administering intravenous morphine for pain relief and obtaining a detailed social history. Option C. Initiating a full diagnostic workup for gastrointestinal causes of chest pain, such as an upper endoscopy. Option D. Assessing the patient's peripheral pulses and skin turgor to evaluate for dehydration. Correct answer is B. Administering intravenous morphine for pain relief and obtaining a detailed social history. Explanation: scenario analysis. This scenario is professionally challenging because the patient presents with a constellation of symptoms that could indicate a life-threatening cardiovascular emergency, but also could be attributed to other less critical conditions. The emergency nurse must rapidly and accurately differentiate between these possibilities to initiate appropriate and timely interventions, as delays can have severe consequences. The pressure to make critical decisions under time constraints, with potentially incomplete information, requires a systematic and evidence-based approach. Correct approach analysis. The correct approach prioritizes a rapid, focused assessment of the patient's airway, breathing, and circulation, ABCs, followed by a systematic evaluation of cardiac-specific signs and symptoms. This aligns with established emergency nursing protocols and guidelines, such as those promoted by the Board of Certification for Emergency Nursing, which emphasize a structured approach to patient assessment in critical situations. This method ensures that immediate life threats are addressed first, while simultaneously gathering information to identify the underlying cause of the patient's distress. The prompt recognition of potential ST elevation myocardial infarction, STEMI, and the initiation of the appropriate diagnostic and treatment pathway, including 12-lead ECG and notification of the cardiac catheterization lab, represents best professional practice. This is ethically mandated by the principle of beneficence and legally supported by standards of care in emergency medicine. Incorrect approaches analysis. One incorrect approach involves delaying a comprehensive assessment to first gather extensive social history or perform a non-emergent diagnostic test. This fails to adhere to the fundamental principle of prioritizing life-sustaining interventions in emergency care. Ethically, this constitutes a breach of the duty to act and potentially violates the principle of non-maleficence by exposing the patient to preventable harm due to delayed treatment. Legally, it deviates from the accepted standard of care for emergency nursing. Another incorrect approach is to focus solely on a single symptom, such as chest pain, without considering other vital signs or potential contributing factors. This narrow focus can lead to misdiagnosis and missed opportunities for critical interventions. It represents a failure in systematic assessment, which is a core competency for emergency nurses. This approach is ethically problematic as it may result in suboptimal care and is a deviation from professional standards. A third incorrect approach is to assume the patient's symptoms are due to a less critical condition without ruling out more serious possibilities. This can lead to a false sense of security and a delay in initiating life-saving measures. It demonstrates a lack of critical thinking and adherence to the principle of rule out the worst first. In emergency medicine, this is a significant ethical and professional failing, as it prioritizes convenience or assumption over patient safety. Professional reasoning. Emergency nurses must employ a dynamic and systematic risk assessment process. This involves a rapid initial assessment of the patient's overall condition, followed by a focused history and physical examination tailored to the presenting complaint. For suspected cardiovascular emergencies, this includes a thorough evaluation of chest pain characteristics, associated symptoms, dyspnea, diaphoresis, nausea, syncope, vital signs, cardiac rhythm, and a 12-lead ECG. The decision-making process should be guided by established protocols, clinical practice guidelines, and the nurse's clinical judgment, always prioritizing the identification and management of life-threatening conditions. Continuous reassessment and adaptation of the care plan based on the patient's response are crucial. Question 7. To address the challenge of accurately assessing a febrile toddler presenting with irritability and decreased oral intake, which approach best aligns with the Board of Certification for Emergency Nursing's guidelines for pediatric care? Option A. Conduct a rapid assessment focusing on vital signs and the most obvious symptoms, assuming the child's behavior is solely due to fever. Option B. Rely primarily on the parent's description of symptoms without performing an independent physical examination. Option C. Utilize a systematic, age-appropriate assessment that includes observing the child's interaction with their environment, assessing for subtle signs of dehydration or respiratory distress, and engaging the child and parents in the assessment process. Option D. Administer antipyretics immediately to reduce the fever, and then proceed with a standard adult assessment protocol. The correct answer is A. Conduct a rapid assessment focusing on vital signs and the most obvious symptoms, assuming the child's behavior is solely due to fever. Explanation. This scenario is professionally challenging because it requires the emergency nurse to balance the immediate physiological needs of a pediatric patient with the potential for delayed presentation of symptoms and the unique communication barriers that can arise with this age group. Furthermore, the nurse must consider the impact of parental anxiety and potential misinterpretation of symptoms on the overall care plan. Careful judgment is required to ensure accurate assessment, appropriate intervention, and effective communication with both the child and their caregivers, all within the fast-paced emergency department environment. The correct approach represents best professional practice because it prioritizes a comprehensive, age-appropriate assessment that accounts for the subtle signs of distress common in young children. This aligns with the Board of Certification for Emergency Nursing's emphasis on evidence-based practice and patient-centered care, particularly for vulnerable populations. By involving the child in the assessment process to the extent possible and utilizing validated pediatric assessment tools, the nurse ensures a thorough and accurate evaluation. This approach also reflects ethical obligations to advocate for the patient and provide care that is sensitive to their developmental stage and potential communication limitations. An incorrect approach that focuses solely on the presenting complaint, without considering the child's developmental stage or potential for symptom masking, would be professionally unacceptable. This could lead to a misdiagnosis or delayed treatment, violating the nursing standard of care. Another incorrect approach that neglects to involve the parents or caregivers in the assessment and decision-making process would fail to recognize the crucial role of the family in pediatric care and could lead to mistrust and non-compliance. Furthermore, an approach that relies on adult assessment parameters for a pediatric patient would be a direct violation of best practice and potentially harmful. Professionals should employ a decision-making framework that begins with recognizing the unique vulnerabilities of pediatric patients. This involves actively seeking information about the child's history, developmental milestones, and any specific concerns from the caregivers. The assessment should then be tailored to the child's age and cognitive abilities, utilizing observation, play, and age-appropriate language. Collaboration with the healthcare team, including physicians and other specialists, is essential for developing a comprehensive care plan. Continuous reassessment and open communication with the family are critical throughout the patient's stay in the emergency department. Question 8. Analysis of an emergency department patient presenting with acute shortness of breath, audible wheezing, and significant anxiety, who has a known history of chronic obstructive pulmonary disease, COPD. The patient is visibly distressed and reports feeling unable to catch their breath. The nurse's immediate priority is to alleviate the patient's dyspnea and anxiety while ensuring respiratory stability. Which of the following initial nursing interventions best addresses this complex presentation within the established regulatory framework for emergency nursing care? Option A. Administer a prescribed dose of lorazepam to reduce anxiety and improve breathing effort. Option B. Administer supplemental oxygen at 10 L/min via a non-rebreather mask to rapidly improve oxygenation. Option C. Position the patient in a high Fowler's position, encourage pursed-lip breathing, and administer supplemental oxygen at 1-2 L/min via nasal cannula, titrating as needed based on patient response and oxygen saturation. Option D. Focus on obtaining a complete set of vital signs and documenting the patient's complaint without immediate intervention until a physician evaluates the patient. The correct answer is B. Administer supplemental oxygen at 10 L/min via a non-rebreather mask to rapidly improve oxygenation. Explanation. Scenario analysis. This scenario presents a common but complex challenge in emergency nursing. Managing a patient with an acute exacerbation of COPD who is experiencing significant dyspnea and anxiety. The challenge lies in balancing the need for immediate symptom relief with the potential risks associated with certain interventions, particularly in a patient with a history of respiratory compromise. The nurse must critically assess the patient's presentation, understand the pathophysiology of COPD exacerbations, and apply evidence-based interventions while adhering to established protocols and ethical considerations. The patient's anxiety further complicates the situation, as it can exacerbate dyspnea and hinder effective communication and cooperation. Correct approach analysis. The correct approach prioritizes non-pharmacological interventions and cautious administration of oxygen. Positioning the patient in a high Fowler's position facilitates optimal lung expansion and reduces the work of breathing. Encouraging pursed-lip breathing helps to slow the respiratory rate, prevent air trapping, and promote relaxation, thereby reducing anxiety and dyspnea. Administering supplemental oxygen at a low flow rate, e.g., 2 L/min via nasal cannula, is crucial because individuals with chronic COPD often have a hypoxic drive for respiration. Administering high concentrations of oxygen can suppress this drive, leading to hypoventilation and further respiratory compromise. This approach aligns with best practices for managing COPD exacerbations, emphasizing patient comfort, minimizing iatrogenic harm, and adhering to the principle of do no harm. It reflects a deep understanding of COPD pathophysiology and the delicate balance required in oxygen therapy for these patients. Incorrect approaches analysis. Administering high-flow oxygen via a non-rebreather mask without initial assessment of the patient's oxygen saturation and without considering the potential for hypoxic drive suppression is a significant regulatory and ethical failure. This intervention could lead to respiratory depression and worsening hypoxemia, directly violating the nurse's duty to provide safe and competent care. It demonstrates a lack of critical thinking and adherence to established protocols for oxygen administration in COP patients. Administering a sedative medication without a physician's order and without a thorough assessment of the patient's respiratory status and potential for respiratory depression is also a critical failure. Sedation in a dyspneic COP patient can further depress respiratory drive, leading to respiratory arrest. This action constitutes practicing beyond the scope of practice and a violation of patient safety protocols. Ignoring the patient's dyspnea and anxiety and focusing solely on vital signs without addressing the primary complaint of shortness of breath is a failure to provide patient-centered care. While vital signs are important, they do not fully capture the patient's subjective experience of distress. This approach neglects the immediate need for symptom relief and can lead to increased patient suffering and potential deterioration. Professional reasoning. Professionals should employ a systematic approach to patient assessment and intervention. This involves 1. Rapid assessment of the patient's airway, breathing, and circulation, with a specific focus on the severity of dyspnea and the patient's level of distress. 2. Gathering a focused history, including the patient's baseline respiratory status, current symptoms, and any recent changes. 3. Performing a physical examination, paying close attention to respiratory effort, breath sounds, and signs of hypoxia. 4. Consulting established protocols and evidence-based guidelines for managing acute COPD exacerbations, particularly regarding oxygen therapy and bronchodilator administration. 5. Collaborating with the healthcare team, including physicians, to develop and implement an individualized care plan. 6. Continuously reassessing the patient's response to interventions and adjusting the plan of care as needed. This decision-making process emphasizes critical thinking, adherence to professional standards, and a commitment to patient safety and well-being. Question 9. Compliance review shows a patient presenting to the emergency department with severe abdominal pain, reporting a pain score of 8/10. The patient's electronic health record indicates a history of opioid use disorder and previous treatment with methadone. Which of the following approaches best reflects current best practices for pain assessment and management in this scenario? Option A. Immediately administer a high dose of intravenous hydromorphone to ensure rapid pain relief, given the severity of the reported pain. Option B. Refuse to administer any opioid analgesics due to the patient's history of opioid use disorder, offering only over-the-counter pain relievers. Option C. Administer a multimodal pain management plan that includes non-pharmacological interventions, judicious use of appropriate analgesics based on pain severity and patient history, and frequent reassessment. Option D. Assume the patient's pain is exaggerated due to their history of opioid use disorder, and focus solely on non-pharmacological comfort measures. The correct answer is C. Administer a multimodal pain management plan that includes non-pharmacological interventions, judicious use of appropriate analgesics based on pain severity and patient history, and frequent reassessment. Explanation. Scenario analysis. This scenario presents a common challenge in emergency nursing, managing a patient with a known history of opioid misuse who is experiencing acute pain. The challenge lies in balancing the imperative to relieve suffering with the need to avoid exacerbating the patient's underlying condition or contributing to diversion. The nurse must navigate patient autonomy, professional responsibility, and potential risks, requiring careful clinical judgment and adherence to established protocols. Correct approach analysis. The correct approach prioritizes a comprehensive, individualized pain assessment using validated tools, considering the patient's subjective report, physiological indicators, and functional status. It involves exploring non-pharmacological interventions, and when pharmacologic management is necessary, selecting appropriate analgesics based on pain severity and the patient's history, with a focus on judicious use and close monitoring for efficacy and adverse effects. This aligns with the Board of Certification for Emergency Nursing's emphasis on evidence-based practice and patient-centered care. Ensuring pain is treated effectively and safely within the context of the patient's overall health status and risk factors. Ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, are upheld by this approach. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's pain report due to their history of opioid misuse. This violates the ethical principle of justice, as it unfairly deprives the patient of adequate pain relief based on a pre-existing condition. It also fails to meet the professional standard of care, which mandates treating pain regardless of its perceived cause or the patient's history. Furthermore, it can lead to undertreatment of pain, causing unnecessary suffering and potentially escalating the patient's distress. Another incorrect approach is to immediately administer a high dose of a potent opioid without a thorough assessment or consideration of alternative strategies. This disregards the patient's history of opioid misuse, increasing the risk of respiratory depression, sedation, and potential for diversion or misuse. It fails to adhere to the principle of judicious medication use and can be seen as a failure to exercise due diligence in patient safety, potentially violating guidelines for controlled substance management. A third incorrect approach is to solely rely on non-pharmacological interventions for severe acute pain, especially when the patient's history suggests a need for pharmacologic relief. While non-pharmacological methods are valuable adjuncts, their exclusive use for significant pain can be ineffective and lead to prolonged suffering, contravening the nursing duty to alleviate pain. This approach may also be perceived as a failure to adequately assess the patient's pain severity and choose the most appropriate treatment modality. Professional reasoning. Professionals should approach pain management by first conducting a thorough, multidimensional pain assessment. This includes using validated pain scales, observing nonverbal cues, and understanding the patient's history, including any history of substance use. Next, they should explore a range of interventions, starting with non-pharmacological options where appropriate, and then consider pharmacologic agents, selecting the most suitable medication and dosage based on the assessment findings and patient-specific factors. Continuous reassessment of pain and the effectiveness of interventions is crucial, with adjustments made as needed. This systematic, patient-centered approach ensures that pain is managed effectively and safely, respecting the patient's dignity and promoting optimal outcomes. Question 10. The risk matrix shows a high probability of patient deterioration due to insufficient staffing levels during peak emergency department hours, leading to delayed assessments and interventions. During a particularly busy shift, a nurse observes a patient exhibiting subtle signs of sepsis that are being missed by an overwhelmed team. The nurse recognizes the potential for severe consequences if this is not addressed promptly. What is the most appropriate course of action for the emergency nurse in this situation? Option A. Immediately advocate for the patient by performing a focused assessment, initiating appropriate interventions, and documenting concerns, while also reporting the staffing issue through established channels for quality improvement. Option B. Focus solely on the immediate patient's needs, providing all necessary care without mentioning the staffing concerns to anyone, as the primary duty is to the individual patient. Option C. Immediately confront the charge nurse and other team members about the inadequate staffing, demanding immediate changes before attending to the specific patient's needs. Option D. Prioritize completing administrative tasks and charting for other patients before addressing the potentially deteriorating patient, as maintaining accurate records is crucial. Correct answer is A. Immediately advocate for the patient by performing a focused assessment, initiating appropriate interventions, and documenting concerns, while also reporting the staffing issue through established channels for quality improvement. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the emergency nurse to balance immediate patient needs with the potential for delayed or inadequate care due to systemic issues. The nurse must act as a patient advocate while also recognizing the limitations of their immediate environment and the need for broader systemic improvement. The pressure of an ongoing emergency situation amplifies the need for swift, yet ethically sound, decision-making. Correct approach analysis. The correct approach represents best professional practice by prioritizing immediate patient safety and well-being, while simultaneously initiating a process for systemic improvement. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, it reflects the professional responsibility of emergency nurses to advocate for their patients and contribute to quality improvement initiatives within their healthcare setting, as often outlined in professional nursing standards and organizational policies. This approach acknowledges the immediate crisis while also addressing the root cause to prevent future occurrences, demonstrating a commitment to both individual patient care and the overall quality of emergency services. Incorrect approaches analysis. One incorrect approach fails to address the immediate patient safety concerns, prioritizing administrative tasks over critical care. This violates the fundamental nursing duty to provide timely and appropriate care, potentially leading to patient harm and contravening professional standards that mandate immediate intervention in emergent situations. Another incorrect approach focuses solely on the immediate patient without acknowledging the underlying systemic issue. While attending to the patient is paramount, ignoring the contributing factors that led to the compromised care environment can perpetuate a cycle of suboptimal care and fails to uphold the professional responsibility to advocate for systemic improvements that benefit all future patients. This approach neglects the broader ethical imperative of improving healthcare delivery. A third incorrect approach involves escalating the issue without first attempting to mitigate the immediate patient risk or gather sufficient information. While escalation is sometimes necessary, doing so prematurely without a clear understanding of the situation or a plan for immediate patient stabilization can be ineffective and may divert resources or attention from critical patient needs. It also bypasses established protocols for problem solving within the healthcare team. Professional reasoning. Professionals should employ a structured decision-making process that begins with immediate patient assessment and stabilization. This should be followed by an evaluation of the contributing factors, including any systemic issues. The nurse should then advocate for immediate interventions to address the patient's needs and simultaneously initiate or participate in processes to address the systemic problems. This involves clear communication with the healthcare team, documentation, and adherence to organizational policies for quality improvement and patient advocacy. The decision-making framework should prioritize patient safety, ethical obligations, and professional accountability. Question 11. What factors determine the urgency and scope of a risk assessment for a patient presenting with a medical emergency in the emergency department? Option A. The patient's chief complaint and the perceived likelihood of a common diagnosis. Option B. The availability of diagnostic equipment and the nurse's personal experience with similar cases. Option C. The patient's presenting symptoms, vital signs, patient history, and potential for rapid deterioration. Option D. The patient's insurance status and the hospital's current bed capacity. The correct answer is C. The patient's presenting symptoms, vital signs, patient history, and potential for rapid deterioration. Explanation. This scenario is professionally challenging because the emergency nurse must rapidly assess a patient presenting with a potentially life-threatening condition, requiring immediate and accurate risk stratification to guide the urgency and type of intervention. The complexity arises from the need to synthesize multiple data points, including patient history, vital signs, and presenting symptoms, under significant time pressure. Failure to accurately assess risk can lead to delayed or inappropriate care, with severe consequences for patient outcomes. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based evaluation of the patient's condition. This involves considering a broad spectrum of potential etiologies and their associated risks, utilizing established protocols and clinical judgment. This aligns with the Board of Certification for Emergency Nursing's emphasis on competent and safe patient care, which necessitates a thorough risk assessment to ensure that interventions are timely and appropriate for the severity of the patient's condition. Adherence to established emergency nursing standards of practice, as expected by the certification, mandates this comprehensive approach. An incorrect approach that relies solely on the most obvious symptom would be a regulatory and ethical failure. This is because it neglects the possibility of atypical presentations or coexisting conditions, potentially leading to underestimation of the patient's risk and delayed critical interventions. Such an approach violates the ethical principle of beneficence, as it fails to act in the patient's best interest by not fully exploring all potential dangers. It also fails to meet the professional standard of care expected of a certified emergency nurse, which requires a comprehensive assessment rather than a superficial one. Another incorrect approach focusing only on the patient's stated chief complaint without further investigation, represents a significant failure. This is a direct contravention of the nursing process, which requires assessment, diagnosis, planning, implementation, and evaluation. By omitting the crucial assessment phase beyond the initial complaint, the nurse bypasses the opportunity to identify underlying or contributing factors that may significantly elevate the patient's risk. This can lead to diagnostic errors and a failure to provide the necessary level of care, potentially violating patient safety regulations and ethical obligations. A professional decision-making process for similar situations should involve a structured approach. First, immediately initiate a primary survey, ABC's airway, breathing, circulation, to identify and address immediate life threats. Concurrently, gather a brief but focused history, including mechanism of injury or onset of symptoms. Then perform a rapid secondary survey, including a full set of vital signs and a head-to-toe assessment, while continuously reassessing the patient's status. Integrate available diagnostic data, e.g., labs, and consult with the interprofessional team as indicated. This systematic process ensures that all critical aspects of the patient's condition are evaluated, allowing for accurate risk stratification and the implementation of appropriate, timely interventions. Question 12. The efficiency study reveals that a significant number of patients presenting with acute shortness of breath are experiencing delays in definitive diagnosis and treatment for potential pulmonary embolism. Considering the critical nature of this condition, which of the following nursing actions best reflects a proactive and evidence-based approach to improving patient outcomes in the emergency department? Option A. Prioritize a thorough patient assessment, including a detailed history and physical examination, and advocate for timely diagnostic testing such as D-dimer or CT pulmonary angiography based on clinical suspicion and established protocols. Option B. Focus primarily on symptomatic management of dyspnea with oxygen and bronchodilators while awaiting further physician orders for diagnostic workup. Option C. Delay further diagnostic investigation until the patient develops more overt signs and symptoms of respiratory distress or hemodynamic instability. Option D. Initiate empiric anticoagulation therapy immediately upon suspicion of pulmonary embolism, even before definitive diagnostic confirmation. The correct answer is A. Prioritize a thorough patient assessment, including a detailed history and physical examination, and advocate for timely diagnostic testing such as D-dimer or CT pulmonary angiography based on clinical suspicion and established protocols. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the emergency nurse to balance immediate patient needs with the complexities of diagnostic uncertainty and potential treatment delays, all while adhering to established protocols and ensuring patient safety. The nurse must critically evaluate the patient's presentation, consider differential diagnoses, and advocate for appropriate diagnostic workup and treatment without compromising the patient's condition. Correct approach analysis. The correct approach prioritizes a comprehensive assessment and timely diagnostic intervention for a suspected pulmonary embolism. This aligns with the Board of Certification for Emergency Nursing's emphasis on evidence-based practice and the critical role of the emergency nurse in rapid patient evaluation. Prompt recognition and initiation of diagnostic measures, such as a D-dimer or CT pulmonary angiography, are crucial for timely treatment and improved patient outcomes, directly reflecting best professional practice in emergency care. This approach adheres to established clinical guidelines for PE management, which stress early diagnosis to prevent complications. Incorrect approaches analysis. One incorrect approach involves delaying diagnostic workup based solely on the absence of classic risk factors. This fails to acknowledge that PE can occur in patients without apparent risk factors and can lead to significant delays in diagnosis and treatment, potentially resulting in adverse patient outcomes. This approach violates the principle of thorough patient assessment and can be considered a deviation from best practice, potentially leading to a breach of the standard of care. Another incorrect approach is to initiate anticoagulation without a confirmed diagnosis or a high index of suspicion based on clinical presentation and initial diagnostics. While anticoagulation is the mainstay of PE treatment, administering it without appropriate justification carries risks, including bleeding complications, especially in patients who may not have a PE. This approach bypasses essential diagnostic steps and can lead to unnecessary interventions and potential harm, contravening the ethical imperative to do no harm. A third incorrect approach is to focus solely on managing symptoms like dyspnea without actively pursuing the underlying cause. While symptomatic relief is important, it should not overshadow the urgent need to identify and treat a potentially life-threatening condition like PE. This reactive approach can mask the severity of the underlying pathology and delay definitive care, which is contrary to the proactive and diagnostic-driven nature of emergency nursing. Professional reasoning. Emergency nurses should employ a systematic approach to patient assessment, incorporating a thorough history, physical examination, and consideration of differential diagnoses. When a condition like PE is suspected, the nurse must advocate for appropriate diagnostic testing based on clinical suspicion and established protocols. This involves understanding the sensitivity and specificity of diagnostic tools and collaborating effectively with the healthcare team to ensure timely and accurate diagnosis and treatment, always prioritizing patient safety and adherence to evidence-based practice. Question 13. Regulatory review indicates that a patient presenting with hematemesis and melena is hemodynamically unstable. The nurse has initiated intravenous fluid resuscitation as per standing orders for hypovolemia. Which of the following actions is the most critical next step in managing this patient's gastrointestinal bleeding? Option A. Performing a detailed abdominal palpation to assess for organomegaly. Option B. Reassessing vital signs and mental status after 15 minutes of fluid resuscitation. Option C. Obtaining a complete blood count in coagulation studies. Option D. Administering a proton pump inhibitor as prescribed by the physician. The correct answer is D. Administering a proton pump inhibitor as prescribed by the physician. Explanation. This scenario presents a professionally challenging situation due to the rapid deterioration of a patient with gastrointestinal bleeding, requiring immediate and decisive nursing action within the established scope of practice and regulatory guidelines for emergency nursing. The challenge lies in balancing the need for swift intervention with the requirement to adhere to established protocols and physician orders, ensuring patient safety and optimal outcomes. Careful judgment is required to prioritize interventions, anticipate potential complications, and communicate effectively with the healthcare team. The correct approach represents best professional practice because it aligns with the Board of Certification for Emergency Nursing's emphasis on evidence-based practice, patient advocacy, and adherence to the nursing process. Specifically, it involves a systematic assessment, prompt notification of the physician, and initiation of prescribed interventions, all while continuously monitoring the patient's response. This approach prioritizes patient safety by ensuring that critical interventions are implemented without delay and that the physician is informed of the patient's changing status, allowing for timely adjustments to the treatment plan. This is consistent with the ethical principles of beneficence and non-maleficence, as well as the regulatory framework that defines the nurse's role in managing acute conditions. An incorrect approach that involves delaying notification of the physician until a more definitive diagnosis is established is professionally unacceptable. This failure to promptly report a significant change in patient condition violates the regulatory requirement for nurses to communicate critical information to the physician, potentially leading to delayed or inappropriate treatment and adverse patient outcomes. It also represents a breach of the ethical duty to advocate for the patient. Another incorrect approach, such as administering medications not explicitly ordered for the current situation, constitutes practicing outside the scope of nursing practice and violates regulatory guidelines that mandate adherence to physician orders. This can lead to medication errors and patient harm. A third incorrect approach, focusing solely on comfort measures without addressing the underlying bleeding, fails to meet the standard of care for a patient with active gastrointestinal bleeding and neglects the nurse's responsibility to intervene in life-threatening situations. The professional decision-making process for similar situations should involve a rapid assessment of the patient's airway, breathing, and circulation, ABCs, followed by a focused assessment of the gastrointestinal system. The nurse must then consult the established emergency nursing protocols and physician's orders for managing gastrointestinal bleeding. Prompt and clear communication with the physician regarding the patient's status and any changes is paramount. Continuous reassessment of the patient's response to interventions and anticipation of potential complications are essential components of effective emergency nursing care. Question 14. Quality control measures reveal a scenario where a physician asks a registered nurse, RN, in the emergency department to perform a complex procedure that the RN has not been specifically trained or credentialed to perform, and which is not typically considered within the general scope of emergency nursing practice for an RN. The RN feels pressure to comply due to the patient's critical condition. Which of the following represents the most appropriate professional response for the RN? Option A. Perform the procedure, as the physician's order and the patient's critical status override the nurse's scope of practice concerns in an emergency. Option B. Politely inform the physician that the requested procedure falls outside of their current scope of practice and offer to assist the physician or another qualified team member in ways that are within their scope, or to help find a colleague who is credentialed for the procedure. Option C. Refuse to participate in any aspect of the patient's care until the situation is clarified, to avoid any potential liability. Option D. Immediately delegate the procedure to another RN who is present, assuming they are competent to perform it. The correct answer is A. Perform the procedure, as the physician's order and the patient's critical status override the nurse's scope of practice concerns in an emergency. Explanation. Scenario analysis. This scenario presents a common challenge in emergency nursing where a registered nurse, RN, is asked to perform a task outside their defined scope of practice by a physician. The professional challenge lies in balancing the physician's directive, the patient's immediate needs, and the nurse's legal and ethical obligations. Failure to adhere to the scope of practice can result in patient harm, legal repercussions, and disciplinary action. The nurse must exercise critical judgment to assess the situation, understand their professional boundaries, and respond appropriately without compromising patient care or their own professional integrity. Correct approach analysis. The correct approach involves the nurse clearly and respectfully communicating their understanding of their scope of practice and its limitations regarding the requested procedure. This aligns with the Board of Certification for Emergency Nursing's emphasis on maintaining professional competence and adhering to established standards of practice. By seeking clarification and offering to delegate to a qualified individual or assist within their scope, the nurse upholds patient safety, demonstrates professional accountability, and adheres to regulatory frameworks that define nursing practice. This approach prioritizes patient well-being by ensuring the procedure is performed by someone competent and authorized, while also protecting the nurse from practicing outside their legal and ethical boundaries. Incorrect approach is analysis. Performing the procedure without proper training or authorization directly violates the nurse's scope of practice. This is a regulatory failure, as it contravenes established nursing practice acts and professional guidelines, potentially leading to patient harm and professional misconduct. It also represents an ethical failure, as it jeopardizes patient safety by undertaking a task for which the nurse lacks demonstrated competency. Immediately refusing to assist without offering alternatives or seeking clarification can be seen as a failure to collaborate and a potential impediment to patient care, especially in a critical situation. While maintaining scope is paramount, a complete refusal without attempting to find a solution within the team's capabilities could be viewed as less than optimal professional conduct, though not as severe as practicing outside scope. Delegating the task to another RN without verifying their competency or scope for that specific procedure is also a failure. While delegation is a nursing function, it requires careful consideration of the delegatee's qualifications and the nature of the task. This could lead to a cascade of scope of practice violations if the delegatee is also unqualified. Professional reasoning. Professionals should employ a decision-making process that begins with a clear understanding of their scope of practice as defined by their professional organization and relevant state/jurisdictional laws. When faced with a request that seems to fall outside this scope, the nurse should 1. Pause and assess the request against their knowledge of their scope of practice. 2. If there is doubt or the request clearly exceeds their scope, respectfully communicate this to the requesting party, citing their understanding of their professional limitations. 3. Offer alternative solutions, such as seeking assistance from a more qualified colleague, collaborating on how the task can be accomplished within the team's collective scope, or offering to assist in a capacity that is within their scope. 4. Document the interaction and the rationale for their decision. This systematic approach ensures patient safety, legal compliance, and ethical practice. Question 15. The audit findings indicate a lack of detailed documentation regarding specific neurological assessments performed on a patient admitted with a suspected head injury. Which of the following nursing actions best addresses this deficiency and ensures compliance with best practices for head trauma management? Option A. Conduct a comprehensive neurological assessment, including pupillary response, motor and sensory function, and Glasgow Coma Scale, and meticulously document all findings. Option B. Assume the patient is stable due to the absence of reported complaints and proceed with routine care. Option C. Ask the patient if they feel their neurological status has changed since their initial assessment. Option D. Review the patient's chart for any existing notes from other disciplines that might indirectly address neurological status. The correct answer is A. Conduct a comprehensive neurological assessment, including pupillary response, motor and sensory function, and Glasgow Coma Scale, and meticulously document all findings. Explanation. Scenario analysis. This scenario presents a common challenge in emergency nursing, where a patient with a suspected head injury requires rapid assessment and intervention, but the initial documentation is incomplete regarding specific neurological assessments. The professional challenge lies in ensuring adherence to established protocols and regulatory guidelines for head trauma management, while also addressing the immediate needs of a potentially unstable patient. The audit findings highlight a deviation from expected standards, necessitating a review of the nursing process and documentation practices. Correct approach analysis. The correct approach involves a thorough, systematic neurological assessment that directly addresses the deficits identified in the audit. This aligns with the Board of Certification for Emergency Nursing's emphasis on evidence-based practice and patient safety. Specifically, it reflects the requirement for nurses to perform comprehensive assessments, document findings accurately, and implement interventions based on established protocols for head trauma, such as those outlined by recognized emergency nursing standards. This approach ensures that critical changes in neurological status are identified and managed promptly, adhering to the nursing scope of practice and regulatory expectations for quality care. Incorrect approaches analysis. One incorrect approach involves relying solely on the existing, incomplete documentation without performing a current, comprehensive neurological assessment. This fails to meet the regulatory expectation for ongoing patient assessment and accurate documentation of the patient's current status. It also represents a potential ethical failure by not actively seeking to rectify the documented deficiency and ensure the patient's safety. Another incorrect approach is to assume the patient is stable based on the absence of overt signs of deterioration, without conducting a detailed neurological examination. This overlooks the insidious nature of some head injuries and violates the principle of thoroughness in patient assessment, which is a cornerstone of emergency nursing practice and regulatory compliance. It also fails to address the audit finding directly. A third incorrect approach is to delegate the complete neurological assessment to another healthcare provider without first performing a baseline assessment and ensuring the delegated task is appropriate and within the scope of practice of the delegate. This could lead to a gap in care and a failure to meet the nursing responsibility for direct patient assessment, potentially violating regulatory guidelines regarding supervision and accountability. Professional reasoning. Professionals should approach this situation by recognizing the audit finding as a trigger for immediate corrective action. The decision-making process should prioritize patient safety and regulatory compliance. This involves 1. Acknowledging the audit finding and its implications for patient care standards. 2. Initiating a comprehensive current neurological assessment to establish a baseline and identify any changes since the initial documentation. 3. Documenting all findings meticulously, addressing the specific areas noted in the audit. 4. Collaborating with the healthcare team as necessary to ensure comprehensive management of the head trauma. 5. Reviewing and reinforcing internal protocols for head trauma assessment and documentation to prevent future audit discrepancies. Question 16. The assessment process reveals a patient who was ejected from a vehicle during a high-speed collision. The patient is conscious but reports severe neck pain and numbness in their lower extremities. They are breathing spontaneously but appear anxious. What is the immediate priority for this patient? Option A. Perform a detailed neurological examination to assess motor and sensory deficits. Option B. Administer intravenous analgesia to alleviate neck pain. Option C. Reassure the patient and explain the potential injuries. Option D. Initiate complete spinal immobilization and maintain airway patency. Correct answer is D. Initiate complete spinal immobilization and maintain airway patency. Explanation. This scenario presents a common yet critical challenge in emergency nursing: the rapid assessment and initial management of a patient with a suspected spinal cord injury, SI. The professional challenge lies in the potential for irreversible neurological damage if appropriate immobilization and management are delayed or improperly executed. The urgency of the situation, coupled with the need for meticulous adherence to established protocols, demands careful judgment. The correct approach represents best professional practice because it prioritizes immediate, life-sustaining interventions and the prevention of secondary injury, aligning with established emergency nursing standards of care and the principles of PSI management. This includes maintaining airway, breathing, and circulation ABCs, while ensuring complete spinal immobilization. Adherence to these protocols is crucial for patient safety and is implicitly supported by the Board of Certification for Emergency Nursing's focus on evidence-based practice and patient outcomes. An incorrect approach that involves moving the patient without adequate immobilization fails to uphold the fundamental principle of preventing further spinal cord damage. This directly contravenes established PSI protocols and could lead to catastrophic neurological deficits, representing a significant ethical and professional failure. Another incorrect approach, such as focusing solely on pain management without addressing spinal stability, overlooks the primary threat to the patient's neurological function and violates the tiered approach to emergency care where life-threatening conditions are addressed first. Administering medications without a clear indication or in a manner that could mask neurological changes also represents a deviation from best practice and could hinder accurate assessment of the injury severity. Professional decision-making in such situations should follow a systematic approach. 1. Rapidly assess ABCs and initiate life support as needed. 2. Assume a spinal cord injury until proven otherwise in any trauma patient with altered mental status, significant mechanism of injury, or neurological deficits. 3. Implement complete spinal immobilization using appropriate devices, e.g., cervical collar backboard. 4. Conduct a focused neurological assessment, including motor and sensory function. 5. Manage pain and other symptoms while continuously monitoring the patient's status. 6. Collaborate with the trauma team and other healthcare providers to ensure coordinated care. Question 17. Stakeholder feedback indicates that emergency nurses sometimes struggle with the initial management of patients presenting with acute abdominal pain. Considering the critical need for timely and accurate assessment, which of the following sequences best reflects the initial priority of care for a patient complaining of severe abdominal pain? Option A. Administer intravenous fluids and pain medication, then proceed with a focused history and physical examination. Option B. Obtain a complete past medical history and medication list before assessing the patient's current pain. Option C. Initiate diagnostic imaging, such as an abdominal ultrasound, immediately upon patient arrival. Option D. Perform a rapid assessment of airway, breathing, and circulation, followed by a detailed pain history and a comprehensive abdominal physical examination. The correct answer is A. Administer intravenous fluids and pain medication, then proceed with a focused history and physical examination. Explanation. Scenario analysis. This scenario is professionally challenging due to the potential for rapid deterioration in a patient presenting with abdominal pain, coupled with the need to integrate multiple pieces of information from various sources. The emergency nurse must prioritize interventions and diagnostic steps while managing patient anxiety and potential communication barriers. The urgency of identifying the underlying cause of abdominal pain, which can range from benign to life-threatening, necessitates a systematic yet flexible approach. Correct approach analysis. The correct approach represents best professional practice by prioritizing a comprehensive, systematic assessment that begins with immediate life-sustaining measures and progresses through a detailed history and physical examination. This aligns with the Board of Certification for Emergency Nursing's emphasis on evidence-based practice and patient safety. The initial focus on ABC's airway breathing circulation is paramount in any emergency presentation, ensuring immediate threats to life are addressed. Following this, a structured approach to pain assessment e.g. PQRST provocation, quality, radiation, severity, timing, and a thorough physical examination, including palpation for tenderness, guarding, and rebound, are critical for localizing the source of pain and identifying potential surgical emergencies. This systematic process allows for the efficient gathering of relevant data to guide further diagnostic and therapeutic interventions, minimizing the risk of overlooking critical findings. Incorrect approaches analysis. An approach that solely relies on patient self-reporting of pain severity without a systematic physical examination fails to meet professional standards. This neglects the objective findings that are crucial in diagnosing abdominal pathology and could lead to a delayed or misdiagnosis of serious conditions. Ethically, this approach breaches the duty of care by not performing a complete and thorough assessment. Another incorrect approach would be to immediately administer strong analgesics without a thorough history and physical examination. While pain management is important, masking symptoms before a diagnosis can be established can hinder diagnostic accuracy and delay definitive treatment for conditions requiring immediate surgical intervention. This could be considered a failure to adhere to best practices in emergency care and potentially violate ethical principles of beneficence and non-maleficence by treating the symptom without addressing the cause. Focusing exclusively on a single symptom, such as nausea, without a comprehensive assessment of the abdominal pain itself, is also professionally unacceptable. Abdominal pain is a complex symptom with numerous potential etiologies, and isolating one aspect of the presentation can lead to a narrow differential diagnosis and missed critical information. This approach lacks the systematic rigor required in emergency nursing and could result in diagnostic errors. Professional reasoning. Professionals should utilize a decision-making framework that integrates immediate life-saving interventions with a systematic, evidence-based assessment process. This involves 1. Initial rapid assessment of ABCs and vital signs. 2. Eliciting a detailed pain history using a standardized mnemonic e.g. PQRST. 3. Performing a comprehensive physical examination, including abdominal assessment. 4. Considering differential diagnoses based on the gathered information. 5. Collaborating with the healthcare team for further diagnostic tests and interventions. This structured approach ensures all critical aspects of the patient's condition are evaluated, promoting patient safety and optimal outcomes. Question 18. Market research demonstrates that emergency departments often face challenges in standardizing trauma assessment protocols. Considering the Board of Certification for Emergency Nursing's commitment to evidence-based practice and patient safety, which of the following approaches best reflects the expected standard of care for a critically injured trauma patient presenting with multiple potential injuries? Option A. A systematic head-to-toe secondary survey, initiated after the primary survey and resuscitation efforts, ensuring all body systems are assessed for potential injuries, with concurrent communication and involvement of the patient when feasible. Option B. Relying primarily on the patient's verbal report of pain and discomfort to guide the assessment, assuming that the patient will accurately identify all significant injuries. Option C. Conducting a rapid, focused assessment based on the mechanism of injury alone, without performing a complete secondary survey to expedite diagnostic imaging. Option D. Prioritizing immediate intervention for the most visually apparent injury, such as a limb fracture, while deferring a comprehensive assessment until the patient is stabilized and less acutely distressed. The correct answer is A. A systematic head-to-toe secondary survey, initiated after the primary survey and resuscitation efforts, ensuring all body systems are assessed for potential injuries, with concurrent communication and involvement of the patient when feasible. Explanation. This scenario is professionally challenging due to the critical nature of trauma assessment and management, where timely and accurate interventions directly impact patient outcomes. The nurse must balance rapid assessment with thoroughness, adhering to established protocols and ethical obligations to provide the highest standard of care. The correct approach represents best professional practice because it aligns with the Board of Certification for Emergency Nursing's emphasis on evidence-based practice and patient advocacy. It prioritizes a systematic, head-to-toe assessment following established trauma protocols. ensuring all potential injuries are identified and addressed. This approach respects the patient's dignity and autonomy by involving them in care when possible and maintaining clear communication, which are core ethical tenets in emergency nursing. Adherence to these protocols is implicitly supported by the certification's focus on competency in emergency care. An incorrect approach that focuses solely on the most obvious injury without a systematic secondary survey fails to meet the standard of care expected of a certified emergency nurse. This oversight could lead to misdiagnoses, delayed treatment, and potentially catastrophic patient harm, violating the ethical duty to provide competent care and the implicit regulatory expectation of thoroughness. Another incorrect approach that neglects to involve the patient or family in decision-making when appropriate, or fails to communicate effectively, demonstrates a disregard for patient autonomy and the principles of patient-centered care. While not a direct violation of a specific regulation in this context, it falls short of the ethical standards of respect and communication that underpin professional nursing practice and are foundational to the values promoted by certification bodies. A third incorrect approach that relies on anecdotal experience or intuition over established protocols risks introducing bias and inconsistency into patient care. While experience is valuable, it must be grounded in and validated by evidence-based practice and standardized protocols, which are the bedrock of safe and effective emergency nursing. Failure to adhere to established protocols can be seen as a deviation from professional standards and a potential breach of the duty of care. The professional decision-making process for similar situations involves a continuous cycle of assessment, intervention, and evaluation, guided by established protocols, critical thinking, and ethical principles. This includes recognizing the urgency of the situation, prioritizing interventions based on the ABDE approach, airway, breathing, circulation, disability, exposure, conducting a thorough secondary survey, and documenting all findings and interventions meticulously. The certified emergency nurse must always strive to provide care that is both clinically sound and ethically responsible, ensuring patient safety and well-being are paramount. Question 19. The performance metrics show an increase in average length of stay for patients admitted with asthma exacerbations. Which factors impact assessment is most critical for improving these metrics and ensuring optimal patient outcomes? Option A. The patient's response to initial bronchodilator therapy and objective measures of respiratory distress. Option B. The patient's self-reported level of shortness of breath and anxiety. Option C. The patient's history of previous asthma exacerbations and hospitalizations. Option D. The availability of prescribed asthma medications for discharge. The correct answer is A. The patient's response to initial bronchodilator therapy and objective measures of respiratory distress. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the emergency nurse to quickly assess the impact of a common but potentially life-threatening condition, asthma exacerbation, on patient outcomes and resource utilization. The challenge lies in identifying the most critical factor influencing patient disposition and length of stay, which directly impacts hospital efficiency and patient safety. Accurate impact assessment is crucial for effective resource allocation and timely patient care. Correct approach analysis. The correct approach focuses on identifying the most significant factor influencing patient outcomes and resource utilization in asthma exacerbations. This aligns with best professional practice by prioritizing patient safety and efficient care delivery. By understanding that the severity of bronchoconstriction and the patient's response to initial bronchodilator therapy are the primary determinants of disposition, admission vs. discharge, and length of stay, the nurse can make informed decisions about further interventions, monitoring, and discharge planning. This proactive assessment directly contributes to meeting performance metrics related to patient flow and reducing unnecessary hospitalizations, all while ensuring patient well-being. This approach is ethically sound as it prioritizes patient needs and efficient use of healthcare resources, reflecting a commitment to both individual patient care and the broader healthcare system. Incorrect approaches analysis. One incorrect approach might focus solely on the patient's subjective report of dyspnea without objective assessment of respiratory status. This is a regulatory and ethical failure because it relies on a subjective measure that can be influenced by anxiety or other factors, potentially leading to under- or over-treatment and misallocation of resources. Best practice demands objective assessment of respiratory rate, work of breathing, oxygen saturation, and response to bronchodilators. Another incorrect approach could prioritize the patient's past medical history of asthma without adequately assessing the current exacerbation severity. While history is important, it does not dictate the current clinical picture. Failing to assess the current severity is a failure to provide individualized care and can lead to inappropriate disposition decisions, potentially resulting in premature discharge of a patient who requires admission or prolonged observation, impacting patient safety and increasing length of stay unnecessarily. A third incorrect approach might concentrate on the availability of discharge medications as the primary determinant of disposition. While medication availability is a factor in discharge planning, it is secondary to the patient's clinical stability. Focusing on this before ensuring adequate improvement in bronchoconstriction and respiratory status is a regulatory and ethical lapse, as it prioritizes logistical convenience over clinical necessity, potentially compromising patient safety. Professional reasoning. Professionals should employ a systematic approach to impact assessment in asthma exacerbations. This involves 1. Rapidly assessing objective parameters, respiratory rate, oxygen saturation, work of breathing, breath sound, response to bronchodilators. 2. Correlating these findings with the patient's subjective experience. 3. Considering the patient's history to inform the assessment but not to dictate it. 4. Evaluating the patient's response to initial interventions to predict disposition and potential length of stay. 5. Collaborating with the healthcare team to ensure appropriate and timely care. This structured decision-making process ensures that patient safety and efficient resource utilization are paramount. Question 20. Risk assessment procedures indicate a 65-year-old male patient presents to the emergency department with severe abdominal pain and vomiting. He is alert and oriented but appears distressed. Upon assessment, the patient states he does not want any treatment and wishes to leave. He refuses to provide further details about his condition or his reasons for refusal. What is the most appropriate nursing action? Option A. Gently restrain the patient and proceed with diagnostic tests and treatment, as his symptoms suggest a serious underlying condition requiring immediate intervention. Option B. Administer pain medication and Roman IV fluids to stabilize him, as his condition warrants intervention regardless of his stated wishes. Option C. Attempt to ascertain the patient's understanding of his condition and the potential consequences of refusing treatment. Explore his reasons for refusal and document the interaction thoroughly. Option D. Immediately contact the physician to prepare for the patient's discharge, as he has the right to refuse treatment. The correct answer is C. Attempt to ascertain the patient's understanding of his condition and the potential consequences of refusing treatment. Explore his reasons for refusal and document the interaction thoroughly. Explanation. This scenario presents a significant ethical and legal challenge common in emergency care, specifically concerning patient autonomy and the duty to provide care when a patient refuses treatment. Professional challenge lies in balancing the patient's right to self-determination with the nurse's ethical obligation to promote well-being and prevent harm. The nurse must navigate the complexities of assessing the patient's capacity to make informed decisions, especially in a high-stress emergency environment where judgment might be impaired. The correct approach represents best professional practice because it prioritizes a thorough assessment of the patient's decision-making capacity. This aligns with the ethical principles of autonomy and beneficence, as well as legal standards that require healthcare providers to respect a competent patient's refusal of treatment. By attempting to understand the patient's reasoning, exploring alternatives, and ensuring the patient comprehends the consequences of their decision, the nurse upholds the patient's right to self-determination while fulfilling their duty to inform and advocate. This process is grounded in the legal and ethical framework that presumes adults are competent unless proven otherwise, and that informed consent or refusal is paramount. An incorrect approach that involves overriding the patient's wishes without a clear determination of incapacity would constitute a violation of patient autonomy and potentially battery. Failing to explore the reasons behind the refusal or to offer alternatives neglects the nurse's duty to advocate for the patient's best interests and to ensure informed decision-making. Administering treatment against a competent patient's will, even with good intentions, is a serious ethical and legal breach. Another incorrect approach, such as immediately discharging the patient without further assessment or documentation of the refusal process, could expose the patient to harm and the healthcare provider to legal liability for abandonment or negligence, Professionals should approach such situations by first establishing a rapport and attempting to understand the patient's perspective. This involves active listening and open-ended questioning. The next critical step is to assess the patient's capacity to make an informed decision. This assessment should consider the patient's ability to understand the information provided, appreciate the situation and its consequences, reason through the options, and communicate their choice. If capacity is in doubt, involving a physician or other qualified healthcare professional for a formal capacity assessment is crucial. If the patient is deemed to have capacity, their refusal must be respected, and the nurse's role shifts to ensuring the patient is fully informed of the risks and benefits of their chosen course of action and documenting this thoroughly.